This is Teresa Omart. Welcome to our Health Services Zoom. I will introduce Mandy Brenchley. She's our VP of Health and Wellness, and she will take it from here and introduce herself and her team. Welcome.
Thank you, Teresa. And good morning, everyone. Thank you for being here. I'm really happy to have the opportunity to share with you how our health and wellness program works at Terwilliger Plaza. But before we dive into services, I want to quickly introduce the health and wellness leadership team you'll be hearing from today, starting with myself. As Teresa said, I'm Mandy Brenchley, VP of Health and Wellness. I have been working in aging services for a little over 20 years. Prior to coming to Terwilliger Plaza, I worked at a skilled nursing facility as a licensed nursing home administrator. I am also a licensed residential care administrator. And I am celebrating my 9th year with Terwilliger Plaza this very month. Tamera, would you like to go next?
Sure. Hi, my name is Tamera Reynolds, and I'm the Director of Wellness and Life Enrichment. I have been at the Plaza. This is my 8th year here, and I came here in 2018 with 35 years of experience in health and wellness and fitness, in the corporate fitness realm before that.
Katrina, would you mind going next?
Hi there, my name is Katrina Mainetti. I'm the Director of Community Social Services here at Terwilliger. I've been working with the aging adult population since 2014. I started out in a memory care community and then since branched out into additional roles until starting my role here at Terwilliger in 2022. I have a deep background in supporting members with Alzheimer's disease and related dementias and dementia education, and I am a certified dementia practitioner.
And then Laurie, that leaves you.
I'm Laurie Barber. I'm the Director of Assisted Living here at Terwilliger Plaza. I've been here for just over 3 years. I've been in healthcare, long-term care specifically for just over 11 years. And I also have my start was in memory care. Spent about 8 years in memory care facility. And I am the licensed administrator also for the Terrace and the Metcalf here at Terwilliger.
Great, thank you. As you will hear, each one of these team members play a pivotal role at each point along the aging journey for our members. So I'm just going to kick it off. One of the most meaningful benefits of living in a community like ours is flexibility, the ability to access the right amount of support at the right time as needs change over time. Our team works very intentionally together. Each program you'll hear about today is part of a holistic approach to support physical health, emotional well-being, independence, and quality of life, regardless of where our members are at in the aging process. And with that in mind, I'd like to start by introducing our Wellness and Life Enrichment program, which focuses on proactive, everyday well-being. So Tamera, will you share how our wellness program is built around the 7 dimensions of wellness that help our members live active and engaged lives?
I would love to do that. So yeah, as Mandy said, we are programming our wellness offerings from a perspective of 7 dimensions of wellness. So most visibly, when you see me and my team, that's going to look a lot like physical wellness. We oversee the fitness center upstairs. We have the aquatic center. We have group fitness classes all over the campus, as well as going outside and experiencing the outside world. But we're also interested in your intellectual wellness, social, emotional, spiritual, vocational, environmental, and everything that makes your life happier, more enjoyable, and helps keep you mobile and vital and engaged. So you could think of that as preventative healthcare, or you could just think of it as creating connections within our community and really making the most of the benefits of living in a community like that. One of our terrific privileges is to offer chances for integration among the different neighborhoods here. We've got our vast majority of independent living members from different buildings, different neighborhoods, as well as our assisted living. And it's a priority and a privilege for us to get to blend those as much as possible. So in terms of physical programming, we do have exercise classes. They're quite hard, and I know I see Tim and I see Al out there who can vouch for how tough we can be on you. And we also have some offerings that regard everybody's level of mobility. And if all we're able to do is create joint mobility and the chance to take some deep breaths, that really does vastly impact your health, your emotional health, and your physical health, and all of the others. So we do that through programming, exercise. We also program a lot of educational opportunities, workshops, chances to learn, chances to become lifelong learners and expand your horizons in terms of the types of activities you're doing. Specifically, we target a few things each year. We have a healthy heart focus. Each February, we do a lot of heart health programming in terms of exercise and health screenings and that sort of thing. In May each year, we do a big wellness fair where we showcase everything that we have going on in the building, but we also bring in community partners from all over Portland to just show you what you have available to make the most of your location in this wonderful place that we are. Each fall we do an active aging week where we get a whole week to really shine the spotlight on each of the 7 dimensions and bring in a lot of programming. In addition to that, our fourth major and constant thing that we're bringing around is our fall prevention program. So we have a balanced tester and a balanced trainer that we can see each person individually and create some assessment and some very personalized and person-centered programming to help you maintain your balance and reduce your fall risk, as well as a couple of fall prevention seminars that we do throughout the year that tie in all of health and wellness and even other departments to show our commitment to fall prevention. And we have a very specific and in-house and unique 8-week fall prevention program that holistically looks at balance and fall prevention throughout, not just making your body stronger, but throughout your whole life to help keep that posture, that mobility, that safety in and out of your home. Let's see what else. I think that may be all of it that I have right now. All right, but yeah, we are around. We have programming 6 days a week. We have, in addition to our group exercise, we have personal training and small group training. We have a very talented small staff who is specializing in a lot of different types of movements. So we do survey and respond frequently to the changing needs of the community. So yeah, thank you.
Thank you, Tamera. As you heard, wellness is about staying active, engaged, and connected. And part of that feeling is feeling supported through the emotional and social changes that come with aging. Another essential part of our health and wellness model is social services, which supports members as they navigate changes associated with aging. And with that, I'd like to invite Katrina to talk more about the support groups she hosts, the resources we have available at the Plaza, and how the transition planning process works for our members.
Thank you, Mandy. As she mentioned, my role really focuses a lot on psychosocial support for members, and that looks a lot different for each person. So that may mean someone coming and having discussions about navigating change because of change in mobility, change in cognition, change in life circumstances. We have a variety of different support groups that I host. We have a low vision support group, a dementia caregiver support group, stronger memory, which is really fun. It focuses on activating our prefrontal cortex through reading and writing aloud. And then in addition to that, we have another group that meets on Tuesday mornings called Exploring Cognitive Impairment. And this group focuses a lot on how we're promoting advocacy, looking into research regarding cognitive impairment, And it gives people a chance who may be experiencing cognitive changes, or those who just want to be better advocates or want to better understand cognitive decline, a chance to really discuss and be part of a smaller community that digs into that a little bit more. I also am on a committee that hosts a group called Mortality and Choices. This is really fun. It is a group that actually formed with a group of members and myself, and we focus on the end of life process and do big educational presentations regarding different realms of support. So we go into different alternative options for people who may be planning for end of life. We have discussions surrounding what documentation, what challenges may arise with those. So it's a really incredible educational opportunity. But we also have a Parkinson's and movement disorder support group, which does welcome people with all types of movement disorders. When it comes to the transition process, my department is the point of contact in trying to determine, is it the right time for me to make a transition to a higher level of care? Is there more that we can possibly offer for me in independent living? So we have some navigational conversations around when it's appropriate for someone to make a big change. I think a big concern of independent living members is, one, when will it be, or is it likely that I'll end up having to make a transition to a higher level of care, which is, again, a very individualized conversation. Our goal is always going to be keeping members in independent living as independent as long as possible. And I think we'll go into a little bit more later on about the transition process and inquiries regarding that.
Thank you, Katrina. Something I want to highlight here that you brought up that's really important is our goal is to support you in independent living as long as it is safely possible. And as Katrina indicated, there are a number of intermittent and situational support services and resources that are available here at the Plaza. We offer a wide range of on-site and coordinated services that scale up or down based on the individual needs or circumstances. One of those supports is our on-site rehabilitation partner, Age Strong by Consanis, who offers physical, occupational, and speech therapy right here on campus to all members, no matter where they live in our community. These services are especially helpful for when a member is experiencing mobility or balance changes, joint pain, decreased endurance, or a need to regain their strength after an illness or injury. These services are typically covered under Medicare Part B with authorization from your insurance provider. And if you have any questions about whether or not these services are covered by your insurance provider, just reach out to Teresa and she can get a hold of me and I can get that answer for you. Another intermittent support many members appreciate is our on-site health clinic. The clinic provides our independent living members access to a licensed registered nurse 5 days a week for non-emergency care, monitoring, and coordination. It is designed to supplement your existing medical care, so it's not there to replace your physician, but it is there to help reduce unnecessary trips off campus. Some examples of when you may want to take advantage of this resource is maybe a new health concern has risen and you are unsure if it warrants a trip to your doctor. So you can use the nurse for advice and guidance. Maybe you need assistance in understanding a new diagnosis after visit summary or care instructions from a recent hospitalization or physician visit. Or you just want somebody to take your vital signs weekly to make sure your blood pressure is where it should be at. We also have a visiting phlebotomist that comes weekly. So if you ever need a lab draw, we can help facilitate that for you as well. The nurse provides basic first aid for minor skin tears to all the way to being able to do dressing changes associated with a recent surgery. And our most popular service, ear lavages. Many of our members take advantage of getting their ears routinely flushed. Additionally, the clinic coordinates with several outside providers to deliver routine on-site services such as podiatry, hearing aid maintenance and support, mobile dentistry, and they coordinate annual flu and COVID vaccination clinics. Services performed by the nurse are fee-based, so they are not covered by insurance. However, services coordinated through visiting outside providers are usually covered by insurance, and those entities manage all of the billing. We also offer safety technologies like medical alert pendants that allow members to quickly access emergency services if they need it. These pendants have fall detection and GPS location capabilities and are available for a monthly subscription fee. And for many of our members and their families, these pendants provide valuable peace of mind and reassurance. For those members who need more hands-on help but want to remain in their apartment, we offer services through our licensed in-home care agency, Ally In-Home Services. Services range from medication management, which can include weekly Medi setups or daily medication delivery. We offer personal care and support with activities of daily living, such as bathing, dressing, light housekeeping and meal preparation, assistance with running errands, grocery shopping, or transportation to medical appointments. We can even be a friendly companion to visit with during the day or provide support to a spouse who needs to run errands for the day and needs somebody to look after their loved one. And something that's very popular here is pet care, because let's face it, not everyone loves to clean the litter box. We are often asked to help people take care of the pets when they're traveling on vacation. And we have numerous pet lovers on staff who would be more than happy to assist you. And for those with long-term care insurance, these services are often covered and we can help coordinate claims. And again, if you have questions, if you happen to have a long-term care insurance policy, I'd be happy to meet with you, Katrina and Laurie. We've all sat in and helped people understand their policy, determine how it works and what specific benefits are covered and how much you'd be looking at as far as that coverage goes. So feel free to reach out. And then for situations requiring short-term 24-hour support, we offer a short stay option in our licensed resident care area, the Metcalf. And at this point, I'm going to take a breath and let Laurie talk to you about this benefit and how it works.
Yes, definitely. Come up for air, Mandy. That's a lot of good information. So one of the really great benefits, and I think something that again kind of helps us stand apart from other places, is the short stay benefit that we offer in our residential care facility of the building, which is the Metcalf. This is a benefit that's available to all independent living members, and every calendar year they receive 3 complimentary nights to stay within one of the 4 dedicated rooms in the Metcalf. And typically this is for somebody that is actually needing 24-hour oversight of a nurse and caregiving staff. Oftentimes that's when somebody's recovering from an illness, they've had a surgery, maybe they're not quite ready to go back into their independent living apartment, they need to regain some more strength, or they need some support with medication management, things like that. There does need to be a medically necessary reason to access that benefit. Otherwise, it's pretty simple as far as what we require to have somebody admit there, which is signed physician orders, an evaluation completed prior to the admission, and being able to reconcile the needs that somebody has, as well as current meds and things like that we might assume the responsibility for when someone's there. The part of this process that kind of tends to take the longest is those physician orders. So if you know that you're planning or you're looking forward to, I say that with a smile, looking forward to a surgery, the sooner that you reach out to me so that we can kind of start the process, I can reserve the space for you, the better off we are. Getting the orders back from the physicians can take the longest. A lot. So the more advanced notice we have to reach out and start coordinating that, the better. And then again, one of our nurses or myself will come and do the pre-admission evaluation to understand what your needs are during the stay. Some people genuinely just need the support of getting in and out of the bed, help to and from the restroom, and the rest of the things you may be able to manage on your own. But in the event that you need more hands-on assistance, that's the real plus of the short stay benefit. It's the 3 complimentary days per year. Some folks stay longer than that. Some folks stay just the 1 day. The process is the same either way for getting you in. And we do have some people that will come and stay overnight for the support that they may need during those hours, but then actually spend time during the day in their independent living apartment. So don't be misled or misunderstand that you're locked away in this space. You can still come and go. People can come and visit you. You can bring your own food. You can, it's just extra added clinical support that you may need after a medical incident of a variety of reasons. So I think that's it, but you definitely want to reach out to me if you do have questions or you want to plan that, and I would be happy to support you through that process.
Thanks, Laurie. I know too that one of the questions that we often receive from members and families is how we coordinate end-of-life support and whether or not someone can remain in their apartment. Katrina, would you mind speaking a little bit to how we approach this?
So end of life, we are big supporters of members having options for end of life support. So members who may be facing a terminal diagnosis and want to pursue hospice services or even palliative services in their independent living apartment, we're happy to support that. We would highly recommend that someone doing hospice within independent living setting would have 24/7 support. Given that there's likely going to be decline over time, that person would highly benefit from having in-home care, family, local, additional medical resources available. In addition to that, we also are happy to support members who pursue alternative end-of-life measures if it's applicable towards their health situation. So we have had members participate in medical aid in dying, or voluntary stopping of eating and drinking, which is sometimes referred to as VSED. Again, the same applications would be suggested to make sure that that person has adequate support. Something that I think is commonly misunderstood that we help educate members on is resources for referrals for hospice. Oftentimes members will get referral source from a primary care provider or another type of provider, but we do encourage members to really take time to form questions that are very specific to their own medical needs and interview multiple hospices. So we're able to recommend a variety of different entities if someone is wanting to pursue that.
Thank you. There may come a time when a member's care needs exceed what can be safely provided in their independent living apartment. In this case, a transition to a higher level of care, which provides access to 24-hour supervised care, may be beneficial. These conversations are spearheaded by Katrina and Laurie, and I'm hoping that you both can provide an overview of the care and services members can expect to receive when moving to the Metcalf or Terrace, and then also talk a little bit more about that transition process. So Laurie, do you want to talk about just first what services look like in the Metcalf and Terrace?
Yeah. Well, we basically can provide care and support to just about anyone on the spectrum that is needing a little additional support or assisted living, somebody that is eligible to admit to this sort of environment. Oftentimes we see people come in that are kind of just at the beginning of needing a little bit of support. We still call them independent and assisted because they really just kind of need our support with maybe the housekeeping and the meal preparation, but they're still very well integrated into the rest of the community. They might even manage their own laundry. They still manage their own activities, salon appointments, things like that. So they're not quite safe enough or comfortable enough to stay in their independent living apartment, and maybe they've exhausted using something like the in-home support, and they make the transition over here to continue going through the aging process with us. And then some folks have maybe stayed a little longer in independent living service or in independent apartments, and need even more care. Or maybe they've had an acute situation, whether that is an illness or an injury that has exacerbated maybe some cognition questions or challenges that they're having, and now they need even more support. So it's kind of looking at it from a level system. We have level ones, which are about as independent as someone could be in this environment, all the way to what we call a level 5, which would probably be somebody that is almost fully dependent, if not fully dependent on all care from us. So independent, active individuals, all the way through bedbound and end of life support is provided within our licensed areas. And I mentioned before things that make us stand out from other assisted livings, and something that truly has Terwilliger Plaza standing out from other assisted living models is that we have a nurse on site 24 hours a day. So we can provide what we would probably call more enhanced care, including that short stay benefit. If we didn't have a nurse on site 24 hours a day, we couldn't actually offer that benefit. But because we have a nurse 24 hours a day, we can really accommodate a higher level of needs than some places that have a nurse Monday through Friday, business hours, and then somebody on call after that, including things like, diabetes, the occasional, I don't know. I could probably go on for too long about the things that we can accommodate. Point is, with nurses here, we can really manage quite a bit. We truly have probably a higher acuity or higher needs population than a lot of assisted livings do, again, because of the nursing team. And then with that, with care needs comes a staffing need, and I think that everybody understands that there are requirements by the state that we staff to a certain level. I think that we staff to that and then above, to make sure that we can not only meet needs that are scheduled for individuals, but those unmet needs like emergencies or quick changes in someone's care and health at the time. I also mentioned keeping our folks integrated into the rest of the community. We really encourage our individuals to continue to participate in activities and events throughout the campus. Because if we think about it, 9 out of 10 of the people that live here came from someplace else on campus at some point. Very few of the people that we have living in the assisted living areas were outside admits. So the folks that live here have a huge foundation of friendship and relationship that they want to continue with, which will also help them be successful as they continue through the aging process with us here. And on the flip side of that, we encourage independent living members to come and visit your friends, come and visit people you don't know, participate in our events and our activities. I know that Community Life is always looking for volunteers to come and spend time with some of our individuals, and they've actually just got a new group of folks that are going to come and spend time with people. But I think that that's really important in the success of our folks going through the aging process here, is that interaction and those relationships. So it's really great that it's effectively an open door to the community that they came from, instead of leaving a standalone home somewhere else in the community and moving into a facility. This is still their entire community, which it makes it a really special place for people.
Another question we hear frequently is how we support members with cognitive impairment without a dedicated memory care neighborhood. And then, as you heard in the introductions, both Laurie and Katrina have extensive memory care experience. So I've asked them to talk about how we lead a person-centered approach to meeting this need. Katrina, would you mind addressing this?
Yeah, I'd be happy to. Something really interesting that I like to share is, prior to starting at Terwilliger Plaza, both Laurie and I actually worked in a community together. And something that we really valued about our setting was that it was a secured setting. When we consider cognition, in a historic global way, we often think that security and having, a locked unit gives more peace of mind to both the people living there and their families. But honestly, when starting at Terwilliger and looking at the difference in the way that the model is presented here, actually changed my entire perspective, given my entire history of memory care. And what I really appreciate about how we approach cognitive impairment here is that we don't often need to rely on a secured setting. And the reason being is that we know with cognitive decline, which we see very often in assisted living and often in independent living, it's about managing how that person is expressing their changes cognitively. So we know, from history that behavior and changes in behavior is often communication. It's an unmet need. It's us needing to redirect. It's us needing to supplement something that's changing. And that person may not be able to identify that within themselves, or us, be able to verbally have that conversation on what exactly is being needed. But when we look at the way the staff interact with members on the assisted living side, because of our staffing ratio, and also it's kind of nice having two separate areas in the community because the staff have a lower ratio to people to really connect with intimately and get to know in a very amazing way. We learn what their behaviors are. We learn what they need. We get to connect with their families. So having to depend on a secure door to deter someone from, say, walking through the community, it's different here because we actually encourage them to. There's a difference between having someone who may not be safe leaving Terwilliger and going downtown and not being able to come back. Those are considerations that are a little different. But like Laurie had pointed out, a lot of people have come from the independent living portions of the community and have transitioned into assisted living. And for that reason, it's very likely that they're incredibly familiar with the campus. And so maintaining that consistency with their routine and promoting them to continue the programs that they've historically enjoyed, with the people that they remember, with the programs that they've participated in for a long period of time, actually helps cultivate a better, cognitive pathway than taking someone out of a routine, transplanting them into a place that they have no autonomy to interact with, their wanting to come and go. So I'm actually quite impressed with how we've approached the concept of cognition here.
Great, thank you. Laurie, did you want to add to that?
I do, because I think that one of the pieces that makes us so successful navigating and helping the members with cognitive challenges navigate their new setting is the work that goes into understanding who they were as a person before their disease and how they lived their life. This is part of that evaluation I spoke to in reference to the short stay. We conduct the same evaluation for that 3-day short stay that we do for somebody that's transitioning in here for the long term. And it really, really, when we use the phrase person-centered, we take that and put it on steroids, and we try to learn literally everything that we can about an individual, because having those talking points with somebody that doesn't know who you are to start, you're going to automatically create a foundation of trust and understanding. A lot of times what I hear is, how do you know that? You can spin that however you want, but understanding these things about people, what they did as, for their career, what their greatest accomplishments were, what their favorite foods and drinks are, what they did for fun, if they belong to any clubs, like what sort of things did they do in their life? Who were they as a person? Not just what are the needs that they have now, so that somebody that comes in here to help to serve this population can pick up what I call the blueprint, which is their service plan, and understand the individual and be able to just kind of jump right into what it is that they need. And if we know, especially when there's cognitive challenges at play, if Susie Q has always just kind of been a homebody and likes to sit in her chair and do her Sudoku and crochet, she's not a wander risk or an elopement risk to us anyway. So cognitive challenges there look different for somebody that comes from a 60-acre farm and was always out moving around and doing all sorts of things. We're going to develop a different service plan for each person based on who they were, so that when those expressions come up, and otherwise known as behaviors, or resistance to care, or things like that, we have something to sort of flip through, in our Rolodex of ideas and why they might be doing this and what we can do to address the need that's now presenting to us. Because it is an unmet need when somebody's doing something now that we don't understand, and maybe they're trying to go home, they're going to walk back to, Patterson, New Jersey at lunchtime, or whatever the case may be. If we have enough information and know the person as intimately as we can probably bring them some sense of comfort and redirect them and keep them safe in this environment that doesn't require bars on windows and locked doors and things. That is not to say that this is always 100% the best place for everyone with a dementia diagnosis, but we are going to try everything that we can in our proverbial toolbox. And that is an interdisciplinary group effort of people that are going to try to make it as successful for the individuals here as possible, if we agree to bring someone into this environment. But like Katrina said, I think there's a little bit of a misunderstanding, a misconception in the world in general that someone with dementia automatically needs to be put away in a locked facility. If we do our due diligence and really put the effort in, I think that people can be successful in the environment that we're cultivating for them here.
I would agree. I appreciate both of you too underscoring the importance of providing person-centered care. It's not just a buzzword. It's very intentional practice, and it's something we've worked hard to integrate into all aspects of services that we provide here. I have just one last question that we are commonly asked that I'd like to answer, and that is whether Terwilliger Plaza offers skilled nursing. And you've already heard Laurie highlight the enhanced services we provide in our both Metcalf and Terrace through the 24-hour nursing support. You now know that we have on-site rehabilitation services. And then I just want to emphasize there are a number of nearby skilled nursing facilities that are within proximity of us that many of our members utilize in the absence of us having skilled nursing. So our short stay benefit fills an important gap, I think, in providing temporary recovery or supervision following an illness, injury, or surgery. But we also strongly encourage members who have been hospitalized for several days to consider a skilled nursing facility stay before returning to the community. And this allows them to take advantage of intensive rehab services that are designed to help them return to their baseline level of function, setting them up for a successful transition back to their apartment. In addition, your skilled nursing care is typically covered by Medicare. So we want to encourage members to take advantage of that benefit. And if they feel they still want some additional support, we'd be happy to take them into short stay prior to their returning to their independent living apartment. Okay, well, I think at this point we have done what we can in the limited amount of time to provide a comprehensive overview of our programs and services under the purview of health and wellness. Thank you for spending time with us today. We're happy to answer any questions.
Thank you, Mandy. I just have to say personally, I mean, when I'm listening to this team talk, I'm just like, oh my gosh, we are so lucky. We are so lucky to have this team of people. So, and I really mean that. So thank you. All right, I have a question, several in the chat room now. If only one spouse needs assisted living, what are the options for the other spouse?
Katrina, do you want to take that one since you manage transitions?
Yeah, definitely. So it's actually not uncommon that we see members who maybe a couple who are living together in independent living. One person definitely could benefit from an increased level of support services, and maybe the other spouse just isn't ready to be in a supportive setting or doesn't have the desire to move. So in that case, one member can absolutely stay in independent living and the other spouse can move into assisted setting, which is really great because then you have access to each other on the same campus. There's not travel that's required of that. And then at a later time, if that other spouse decides they want to transition, something that's really great that's set up within the model of how our maintenance fees work each month is that, that base level of care is going to be determined on that higher level of care, which Laurie kind of got into the scale that we see. But then there would just be a flat rate for that next person coming in based on their level of care. So it really tapers down on how much the cost would be to have two people living in assisted living.
Let's see. Next question is, are there specific definitions for each of the levels of care from 1 to 5?
Not specific. I mean, there's something that breaks down kind of what the general idea of what a level care of what each level would be, but I think that it can really expand, and I think actual conversations and what we discover at an evaluation and information that comes from a physician as far as histories and physicals, medications, diagnoses, that's going to really take our basic, like, here's the general idea of what a level 1 would be, and add all of that additional information. So it's case by case, and really more of a conversation to have during that evaluation process or once that's completed.
How does long-range care insurance fit into the Terwilliger model? I think there's another question about that as well. I think it's more about like, how do we coordinate? And Mandy, you mentioned help assessing policies, but I'm thinking maybe this person might be referring more to the billing part. Like, do we bill insurance?
Yeah, so depending on the long-term care policy, what we'll do is we'll help with the claims process. So a lot of them have a form that Laurie or Claudine, our director of in-home, complete at the end of each month. They'll send the statement and the form to the long-term care policy provider for that. So most policies are set up on a reimbursement basis. So what means is you're going to pay the money up front and then your policy is going to reimburse you. Hopefully that addresses that question.
Well, and just to piggyback that, from what I understand, there's a daily rate, a maximum daily rate that they'll reimburse you for. So even though, hypothetically, your monthly maintenance fee in assisted living is $5,000 a month, your policy may only reimburse you $200 a day, or something along those lines. So the best advice that I can give is to call your customer service representative at your long-term care insurance company and ask them those questions. And then just to put this in your back pocket, they reimburse a month behind. So for example, today I'm sending March statements. So somebody's already paid for March, and I'm just now sending it to the long-term care insurance company, and they will reimburse within about 10 days to the person for the month of March. So it's always 1 month behind. There was something else I was going to say about how that works, but I lost it.
Well, and I'll just add real quick, many policies also have an exclusionary period.
That's what it was.
I had a feeling.
The waiting period.
When you make that phone call to ask these questions of your policy provider, ask what the exclusionary period is. A lot of times it's
90 days.
60 to 90 days, which means that you're going to be paying everything out of pocket during that period. And then the policy will start kicking in after you've satisfied that requirement.
Let's see. How formal is the decision that Terwilliger Plaza is no longer an appropriate home for people with cognitive impairments? How do you support and manage the transition out of Terwilliger? Finding a more appropriate living situation.
I think I can speak to this one. So it's really not very common that we find ourselves in the situation, thankfully, given the parameters that we discussed earlier with how we handle cognitive impairment. I can give an example. We once had a situation arise where, we had a gentleman on campus who his entire background was the outdoors. He guided hikes, he loved to hike, he loved to go for walks. He was a very solitary person, wasn't a big group exercise or get to know new people kind of person. His spouse also lived here. And when looking at the consideration of Terwilliger no longer being the appropriate setting for him, it became from a safety perspective. So he was oftentimes leaving the community and getting lost, unable to find his way back to Terwilliger, which was really stressful for his family. And we had a really in-depth conversation with the family. Like, what does it look like for him to come into assisted living and us put these parameters where, we're constantly redirecting him. Like, oh, hey, sir, we can't actually go out that door. Well, let's not go that direction. Well, actually, let's go to this group and participate so we can keep our eyes on you. That wouldn't have really honored who he was as a person or what he appreciated. And so for us, collectively, we identified, there was a memory care facility, which he was definitely dealing with pretty rapid cognitive decline, but his body was still incredibly healthy. And this particular campus had a very vast garden setting that allowed him to, in an autonomous fashion, go for walks, seek the outdoors when he wanted to, not have to have someone with him every moment of that, not have to be redirected. And that for him was a more feasible option to actually honor who he was, what he valued, what his passions were, versus us saying, yes, of course, we'd like for you to come and be a part of our assisted living setting and the spouse to join him. She did, in fact, choose to move with him because she wanted to be at the same campus. And we always have that conversation where if someone later down the road changes their mind and we're able to do an assessment and identify if their needs have changed and this is a more appropriate setting as things shift, that's always a conversation we're willing to have. But that's the best insight I can give into that particular situation.
I did see partway through this event, Andy Fitzgerald, who is our COO, and Ryan Miller, who is our CEO, president and CEO, joined. I think they're both still on. I don't know if either of you have anything to add, or anyone, since we've got a couple minutes here, if you want to fire a question at the COO or the CEO.
I'll just say, hi everyone. This is Ryan Miller. It's great to see a lot of familiar faces on this Zoom. I hope you felt that this was useful and helpful information, and thank you, Health Services, for setting aside some time to talk about our great program.
And I'm
My
Andy
pleasure.
Fitzgerald. I'm the COO, and I echo Ryan's statement. Thanks. I know we came in kind of midway, but what we did here, the Health Services did a great job. So thank you guys.
Thank you both. This is covered sometimes in some of our other events, but I just want to point out, being a single site community like Terwilliger Plaza is, our CEO, COO, VP of Health Services and Wellness, they're right here in the community, so you can chat with them. I mean, they're on the Zoom here, but you actually can walk down the hall and knock on their door and say, hey, Ryan, hey, Andy, hey, Mandy, I have a question for you. So it's a benefit, and a lot of our members really appreciate that they're not sitting somewhere in another state in a corporate office somewhere. So we love having them right here. Okay, so I think that's it for questions. Thank you again for everyone joining us. Thank you. If you have any follow-up questions, you can reach out to myself or Jojo or Jessica.